Hi, my name is Allison Morrison. The issue that I looked at was 30-day heart failure readmission rates. Beginning in 2012, readmission measures for heart failure were included in the Hospital Readmission Reduction Program, and this in turn affected reimbursement. As a result, it has placed financial burden on several healthcare entities as well as patients. Heart failure is a chronic disease with episodes of exacerbation. It often results in hospitalization, which can be very costly. According to the American Heart Association, more than 650,000 new cases of heart failure are diagnosed every year. So in an effort to decrease healthcare costs, hospitals are looking at ways to decrease these 30-day readmissions. Several studies that I looked at found that using TeachBack did indeed decrease 30-day readmission rates for heart failure patients. Now, when it comes to change, we all know that leaders must create an adaptive environment. So I looked at transformational leadership theory and Lewin's change theory as the framework for implementing TeachBack. Lewin's change theory proposes that individuals are affected by restraining forces that help to keep the status quo and driving forces that enable change to occur. He also suggested that knowing the behaviors of individuals helps in planning change at any level. Lewin's change theory has three phases. Unfreezing is the first phase. This is when the need for change is identified. This is also when the driving forces and the restraining forces are identified. And since change is often met with resistance, transformational leaders can help motivate individuals to change. They can also help their employees recognize issues to assist them in solving problems, as well as help team members cooperate with one another, resulting in increased team performance. Lewin also suggested that knowing individuals' behaviors would impart understanding and the capacity to plan change. Change requires good leadership, and transformational leaders know that leaders are created by followers. Allowing followers to be part of the decision-making process empowers them by making them more aware of the goal, thus becoming leaders themselves. The second phase of Lewin's theory is moving, which requires individuals to move to a new way of existing. Transformational nursing leadership is necessary to create a framework for moving that influences expectations, thus empowering the sustainability of evidence-based practice. Fear is often associated with change, and there may be people who need to be convinced that change is necessary. So it's important to overcome this fear during this phase. Transformational leadership has been found to increase the well-being of staff in a positive way, thus helping to decrease their fear of change. Refreezing is the final phase of Lewin's change theory. It involves strengthening the driving forces, thus stabilizing the change. It also includes placing the change in policies and asserting that it is implemented as current practice. This stage is imperative in order for change to be sustained over time. Using transformational leadership, it will help transform nurses into leaders and develop ownership of the project and hopefully increase sustainability of the project. So in summary, decreased reimbursement based on 30-day readmission for heart failure patients has forced healthcare facilities to make changes to decrease this problem. Unfortunately, change is met with resistance. By using a transformational leadership style in Lewin's change theory, the transition can produce empowered nurses as well as a smooth process for change, thus leading to improved and efficient healthcare. For change to be successful, followers need to be motivated by a transformational leader. By addressing the fears that often accompany change and decreasing restraining forces and emphasizing driving forces, change can be rewarding. Thank you for watching.